Today we are going to talk to you about Xanax. It is also commonly called alprazolam. Why would you take this drug? This drug is going to be used for anxiety and panic disorders. For anxiety, it could be used for generalized anxiety disorder, and this is defined as unrealistic or excessive worry about 2 or more life circumstances for 6 months or longer. It also could be used for general anxiety associated with tension or stress, and also for anxiety associated with depression. For panic disorders, it's going to help treat those recurrent and unexpected panic attacks. How does this drug work, or the mechanism of action? So this drug is going to work on the CNS, and it's going to make a person calm. It's going to do this by getting rid of the stress or tension or trying to reduce the worry in the person, and it's going to do this by enhancing the effects of GABA. Xanax belongs to the benzodiazepine class. Again, it's going to work by targeting that neurotransmitter GABA, and it's going to be given through an oral administration, so taken by mouth. For the dosage of this drug, it's going to depend what you're taking it for. So for anxiety, we're often going to start with that 0.25 to 0.5 milligrams 3 times a day. You're then going to increase in intervals of 3 to 4 days until you reach that maximum daily dose of 4 milligrams. Just a side note here, it is not recommended to increase more than 1 milligram per day. For panic disorder, it's going to have more of a broad range from 1 to 10 milligrams per day. In general, the studies found that more than 4 milligrams is most effective. Precautions and contraindications. So starting with precautions, we want to be extra careful in those patients who have thoughts of suicide. Also in those with mania, which are episodes reported in those with depression, so more associated with anxiety. And we want to be careful in patients with contaminant illness. For these patients, we're going to lower the dose to prevent that over-sedation. Also in alcoholic liver disease in obese patients, with these patients, they usually have a decreased elimination rate. And finally, in nursing mothers, this drug can be excreted in human milk, so it can cause babies to lose weight. For contraindications, it has no insensitivity to other benzodiazepines. It should not be taken with narrow-angle glaucoma, and it should also not be used with these 2 anti-infungals that are listed. Some side effects or drug reactions that we might see from Xanax include drowsiness, dizziness, changes in sex drive. You may have mental or mood changes, and this could come with hallucinations or thoughts of suicide. They may also have trouble walking and loss of coordination, memory problems, trouble speaking, and with this would come the slurred speech. Although these adverse reactions are something to consider, they are often very rare. Here's a list of drugs that will have adverse drug reactions with Xanax. You will note that most of the drugs increase plasma concentration. We have to be cautious with this because this means that we will have a greater response to the drug. There's only one medication on this list, the profoxifene, that decreases the concentration of the drug. With other CNS depressants, we have to be careful with this because the patients will often have lower blood pressure and experience slowed breathing and extreme sleepiness. That digoxin, we specifically want to watch for that in the elderly with the toxicity. Some signs of this might be nausea, vomiting, or abdominal pain. If they have cardiac complications, this could be really serious and could potentially be fatal. With that last drug on the list, you will notice that it is an inducer of CYP3A. This is a gene that's important for drug metabolism, and it has reactions with Xanax because Xanax initially acts on it, so it increases the metabolism of Xanax. The pharmacokinetics of this drug. So as stated earlier, it is given orally by the mouth. It is readily absorbed. It has a peak concentration that occurs 1 to 2 hours following administration, And finally, it has a mean half-life of 11.2 hours. The monitoring of this drug, so it is a controlled substance and it's classified as a Schedule 4 drug, so it's at the lower end for chance of abuse, meaning that it has a limited level of dependence, but if it was stopped urgently, you could still experience withdrawal symptoms. Most of the special considerations with this drug are going to be associated with that drowsiness and dizziness. So some things that we can do to help with this, we're going to want to remember to get up slowly when rising, to avoid alcohol, to not drive if we're experiencing any drowsiness or dizziness. You may have those seizures if the medication is stopped quickly, that's that withdrawal reaction. Want to be sure to check any cold and cough medications to make sure we're not increasing the drowsiness. Smokers may have less of a response to the medication, and it may not be a good choice for those with liver or kidney disease or breathing problems.
Some of the side effects of Xanax include loss of coordination, drowsiness, and dizziness. These are especially important for the physical therapist, as when you are working on gait training with patients, they could have troubles with the coordination of the walking pattern. If a patient is drowsy, they may not fully engage in physical therapy, or if a patient is dizzy, they may have a safety concern if they are doing exercises which cause fatigue. The first study was entitled Comparison of Effects of Oral Melatonin with Oral Alazapram used as a pre-medicate in adult patients undergoing various surgical procedures under general anesthesia, a prospective randomized placebo-controlled study. When a patient is taking Xanax or alazapram, it is currently contraindicated to use that drug prior to surgery due to the dangerous drug interactions of anesthesia and alazapram. This study looked at oral melatonin versus alazapram on the effects of a patient's anxiety, sedation, orientation, and cognitive function. It was placebo-controlled, and the results of the study was that taking an oral melatonin of 6 milligrams when used as a pre-medicate is an effective alternative to alazapram regarding providing better angsalosis, lesser sedation, along with a maintenance of cognitive and psychomotor function. Overall, oral melatonin can be used as a replacement to a patient taking Xanax or alazapram prior to surgery. The next study we looked at investigated inhaled versus oral alazapram, subjective behavioral and cognitive effects, and modestly increased abuse potential. This study looked at an alternative administration of alazapram or Xanax. So the objective was the study was to determine if the rate of onset of subjective effects and abuse potential of alazapram would be increased when administered via inhalation versus the oral route. This study was double-blind and placebo-controlled. The results of the study indicated that inhaled route of administration moderately increases the abuse potential of alazapram, despite significantly increasing this rate of onset. What this means is that if a patient is having a severe panic attack or anxiety attack, they could take an inhaled version of alazapram and receive the effects immediately. However, there is significant potential for abuse utilizing this method over the traditional tablet method. Therefore, they concluded that if you market the inhaled version at an increased cost, it could potentially reduce the abuse potential.